The Urban League of San Diego County is on the front line of education and youth development, empowering workforce, housing, and financial development. We provide community health and wellness opportunities and civil rights and civic engagement. Welcome to the Urban League Today with hosts Abdallah and Herman Collins.
In March 2020, the COVID-19 pandemic shut down America's economic and social fabric. As we are crawling out of 15 months of quarantine and the availability of a COVID-19 vaccine, we are slowly returning to the workplace, school, and large social gatherings. Questions still remain about the viability of the vaccine. Do I have to work with those who may not be vaccinated? And how safe am I in social gatherings? And with that, I want to turn it over to Herman Collins, who will be today's moderator. Take it away, Herman.
Thank you, Al. Today's guests represent a cross-section of medical professionals who will share with us their involvement in the COVID community discussion and what you should know going forward. Join me in welcoming Drs. Hood, Robinson, and Carson. Doctors, if we could, let's start with just a round-robin discussion of sharing your role in the community discussion of COVID. And I'd like to start with Dr. Hood, go to Dr. Robinson, and then end with the rows in the group, Dr. Carson.
Yeah, well, thank you. I'm Dr. Rodney Hood. I've been practicing in San Diego for the past 40 years. I'm internist, internal medicine. The beginning of COVID, I was concerned about the impact this was going to have on the Black and minority communities. For over 30 years, I've been researching disparities between the various ethnic groups and the impact that it's had on African Americans. So it was clear to all of those of us who have been involved in health that the impact was going to be greatest on African Americans. Over the past year, I formed the COVID Equity Task Force, which includes over 150 individuals in San Diego County, mostly minorities and ethnic physicians that have been focused on making sure that the impact on the minority communities were blunted. I've been fortunate enough to be appointed to a local task force by the county called the County Advisory Group. At the state level, the governor appointed me to the governor's task force to look at the vaccines and recommend the vaccines to the members of California. And on a national basis, the National Medical Association, African American Physicians formed a COVID Equity Task Force. As a result, I've had meetings with Pfizer and Moderna and J&J and have been making recommendations that hopefully will bring health equity to the African American community.
Great. Dr. Robinson.
My name is Jerome Robinson. I'm a cardiologist, been practicing in San Diego since 1985. I'm currently the health chair for the NAACP, and as a result, I have tackled this COVID-19 crisis mainly because I've been reporting out COVID statistics and what everyone needs to know for the Black Men and Women United group meetings since the start of this epidemic. Through the NAACP Health Committee, we did a video on vaccine hesitancy, and I'm still talking about COVID-19 in terms of how it affects the community and what we can do to avoid some of the things that I've seen coming.
And Dr. Carson.
I'm Dr. Latisa Carson. I'm a board certified obstetrician and gynecologist and a medical weight loss specialist. As the only African-American solo obstetrician gynecologist in private practice in the county of San Diego, I have had the opportunity to speak to small groups, small community groups, women's groups, youth organizations concerning COVID-19. I've also been able to use my social media platforms on Facebook and Instagram to educate the community, my family, friends, and potential patients or clients for my medical practices. I had the also opportunity to work with Dr. Robinson with the NAACP in making a video to outreach to the community, the state, and possibly the nation at large. So those are the things that I've been doing on the local level to influence the people that I know and reaching out through my social media platforms.
Thank you all. Appreciate all of you taking time out of your busy schedules to be with us today to discuss this very, very important topic for our community. Under the category of returning to work, and I'll start with you, Dr. Carson. Worksite requirement testing. Can you elaborate on that particular area?
I think at this time, there aren't any laws or requirements in place to require employees actually to be vaccinated to work. I've seen some reports on some hospitals and healthcare practices and settings that may be requiring their employees to be vaccinated before going back to work. Currently, in San Diego County, the hospitals and healthcare facilities are still requiring that everyone remain masked up, regardless of their vaccination status. So I think we're waiting on some more information from the county health officer as well as the state on going forward. But those are the requirements currently in the hospital and healthcare settings.
Thank you so much, Dr. Carson. And Dr. Hood, could you speak to the requirements of daily temperature checks, social distancing, and masking at work?
Yeah, so tying into what Dr. Carson has said, it is true that in the healthcare industry, doctors' offices, and hospitals, it is still required that you mask up, and some still do the temperature checks, and that type of thing. So I think that the good news here in San Diego County, about 79% of the population who's eligible for the vaccination have received at least one vaccination, and about 68% have received both vaccinations. So in San Diego County, we've achieved quite a bit. That and what we're seeing is that although vaccines are not 100%, by the fact that you get vaccinated, it's not 100%, but it's over 90% that if you do get it, it won't be as severe. But that means that there's still 30-40% of the population that is unvaccinated. And those are the ones that are still getting sick, winding up in the hospital and dying. So because there's still that amount of folks that are unvaccinated, it is still recommended that you use common sense. Indoors, if you're not sure of the population, whether they're vaccinated or unvaccinated, not with your family, you should probably mask up, social distance, etc.
As we're closing down many of the community testing sites, what impacts can we expect there? And I look at this, Dr. Hood, is that I was looking at one of the county statistics that show that the number of testing and as well reported infections in zip code 92114 and 113, where much of the black community is located, or suspected black community is located. The testing levels are so low that we're really not getting a good indication of what the impact or the infectability may be.
Well, I think the focus has been on the vaccination, and you're right. I told you the good news about the high rates of vaccination, but if you look at who's been vaccinated by race and ethnicity, the African Americans have the lowest rate of vaccination in the county. So if you look at the eligible population beginning at 12 years and above, you have Asians, 66.5%, blacks at 38%, Hispanics at 63%, whites at about 60%. So blacks have the lowest vaccination rate. I think that the concern about testing is that if you're unvaccinated, I think it's important to get tested periodically. And as you know, there's a new variant out there. It's the Delta variant. And there's some indication that that is more infectious, 2 to 3 times more infectious. More people are dying from that. And although most of the vaccines are effective against it, they don't appear to be, at least the J&J vaccine does not appear to be as effective as it is against the other variants. So I think we still got a ways to go, and we still need to encourage folks to get vaccinated.
Dr. Robinson, piggybacking on what Dr. Hood just mentioned about the Delta variant, we've been hearing that since this particular variant is much more deadly, that there may be a need for a booster shot within 6 months of receiving any of the three vaccinations. Can you speak to that for our audience, please?
The Delta variant is certainly very troublesome and worrisome, particularly for the African American community. Piggybacking on what Dr. Hood said, if you look at the African American community in San Diego County, about 58% are not vaccinated at all. 36% are fully vaccinated. That's troublesome. The Delta variant now, as we have seen, and the indications are that this variant is much more infectious, and the vaccines, although they are still effective, may not be as effective as they were. Maybe the Pfizer vaccine is down to some 60% effectiveness. And this is on data out of Israel, a country that has had great success in trying to vaccinate its full population. So my worry is this. One is that in order to protect ourselves against the Delta variant, we need more people vaccinated. In this county, we have a number of African Americans who are not vaccinated, and that leaves open those who are not vaccinated to be subjects of this lethal variant. In terms of the recommendations from the CDC, the County Health Department, and the NIH, there's no recommendation at present for a booster shot so far. This certainly may be a possibility because of the effectiveness of the vaccines being not in the 90s anymore, but being down to 60% in terms of this Delta variant.
Great. We've talked about trusted voices and those folks that need to be speaking in the community to help get the word out on continuing to get the vaccination rate up and as well making sure that the folks are there. This may be a little bit controversial, but I'm going to throw it out here because we've got churches now that are rushing to reopen their doors. Church ministers have probably been one of the greatest trusted voices in the African American community. Dr. Carson, Dr. Hood, Dr. Robinson, what should churches responsibly be doing at this point in not only reopening the doors, but as well spreading the word about the virus, vaccination, etc.? We'll start with you, Dr. Carson.
I think it's going to be important to get other community leaders involved, especially the pastors, in getting the word out to the community about vaccination. One thing that we know at the beginning of this virus, there were some of the largest outbreaks were within churches, choir rehearsals, bishop meetings. And so we know that these are areas, or these are places of large gatherings where people are very close. And so we really need to continue to educate the leadership in the church community about the importance of vaccination and trying to encourage their parishioners to get vaccinated against the virus. So that's going to have to come from the local level. Some of the trusted people within the community, people who have their faces are familiar, they've been seen, they've already been working in the community, so that people already come to trust them.
Dr. Hood, I'm going to kind of throw you under the bus here and ask a kind of a difficult question. Churches are kind of varying right now on what their requirements are for their parishioners as they reopen their doors. Some have extremely strict requirements, still wanting to stay at the 25% capacity. Some are opening the doors and everybody is hugging and free love. What do we risk when we are being a little bit too casual right now?
Yeah, so I thank you for that question. And no, I don't think that's throwing me under the bus. We're really at a very critical time now where, as you notice, there were no criteria given to the churches. And I have been asked by several as far as recommendations, and you're right, not just black churches, but all churches have different criteria. And so I can only tell you what my recommendation was when I was asked. Although they're all doing it differently, I think they all mean well. Churches, especially in the African American community, still have a high rate of elderly folks going to a church who are very high risk. And even if they are vaccinated, as I stated, the vaccine is not 100%. And so there are a few folks who are still vaccinated that can get infected, and if you're elderly, may get sick. So when I have been asked that question, I have said that I would still practice social distancing going to church. I would encourage vaccinations. I personally would consider having one section for the vaccinated folks and another section for the non-vaccinated if possible. I would practice social distancing within the church, or maybe just having family units that feel comfortable being together, and continuing to mask, especially if the church was indoors. So that was my personal recommendation, since there were no definite criteria. I do agree. I would be concerned just loosening up and going back to church as usual with the greetings, etc.
Dr. Robinson, thank you very much, Dr. Hood, for that explanation. Dr. Robinson and also Dr. Carson, the long-term impacts of the infection with respect to cardio and respiratory, can either or both of you speak to that? We've been hearing in the news this term called long haulers, and for our audience that's not familiar with that, can you elaborate on that, please?
Certainly, I'll take the first stab at that. The long hauler syndrome that we've seen in patients who've been infected with COVID-19 are those who have symptoms persisting after 4 weeks having had their first contact with the virus. And these symptoms are quite troublesome. First of all, who is going to get long haulers? What we know, even though folks have only had mild disease, maybe didn't end up in the hospital, as many as 20% of those may end up with the long hauler syndrome, and I'll get into that in a minute. For those who've had severe symptoms or hospitalizations, that number may go up as high as 50%. So it's very troublesome. Even if you get it, you can have these consequences. In terms of the impact on cardiovascular disease, one of the things that we've heard about that's recent is the incidence of myocarditis associated with the mRNA vaccines. And people are afraid about that, and it occurs in young folks. What we know is that there have been 780 reported cases as of my research on Monday, and about 500 plus of these have been confirmed as possibly being due to COVID, to the vaccine. What we do know is that if those folks had been vaccinated, there are several thousand cases of COVID-19 that would have been prevented. There are several hundred hospitalizations and 100 maybe or so admissions to the intensive care unit, and maybe 2 or more deaths in males and 1 to 2 deaths in females. So in terms of the benefit versus risk ratio, there's a ratio in favor of getting the vaccine. Now, in terms of vaccines, just to go into that a little bit before I go on to something else, and that is, one of the things we know is that these vaccines are much safer than the vaccines we received going to school that we were required to get. There are about somewhere between 8 and 13 or so vaccines that are now required. Everybody gets their MMR, everybody gets their polio vaccine, everybody gets their measles vaccine, their rubella vaccine, their meningitis vaccine, and vaccines against getting a form of cancer. So this vaccine that we currently have is much safer than those. If you go back into the history of vaccines, you'll find that there were a number of problems associated with vaccines as they were developed moving forward. And this series of vaccines that we have are currently much safer than that. So I'm in favor of getting vaccines, and we have to protect the folks that can't get vaccinated, those who are less than 12 years of age. These are the children that are going to be going back to school. And if we have a population of folks that are not vaccinated, it puts those children at risk for developing the disease. And so the best way that we can avoid having our children develop this disease is to get vaccinated. In terms of the long hauler syndrome, there are many things associated with that. One of the things that's been associated with that is this brain fog that people talk about, in that folks can't think, they can't concentrate, and they can't do the things that they used to do with fidelity. Some patients have experienced problems with exercise, that they can't do things that they used to do. Chronic fatigue, tiredness, muscle aches and pains. These are all symptoms that can go on for some time, and that they're very troubling for patients who cannot do the things that they used to do, including even work. So we have to look at that. One last thing in terms of San Diego County and looking at who's at risk for this. If you take the age group from 0 to 49, that's over 60% of the population at risk who are developing COVID-19 disease in this county. And for the most part, when we look around the country, these are folks who have not been vaccinated. In some states, as high as 99% of the new cases are those who are not vaccinated. So we have to pay particular attention and think about what we need to do in terms of protecting our children when they go back to school. And I'll stop there.
Dr. Carson, in closing, I have a couple questions for you, and this pertains to our youth. I know just recently, our 12 to 17-year-olds were available to get vaccinated. I'd like you to speak to the importance of that, and also the youth under 12 years old that'll be returning to school in the next month or two. Can you speak to that?
Yes, I'm glad that the studies went forward, including the pediatric population, and now that the 12 to 17-year-olds are able to be vaccinated, that will open up the schools a lot better for the older students, because we knew that a lot of times the older students, and especially in homes, people of color in our homes, there are multiple generations living in the home, parents, grandparents, great-grandparents. And with those populations that were at higher risk, younger people would have mild symptoms, but would spread COVID-19 to the adults and older adults in the family. Also, this will give an opportunity for the teachers to be protected at the schools. They are essential workers and frontline workers, and this will also protect the staff at the school as well. As far as younger children, a lot of the schools are still trying to pivot and try to determine how they're going to protect the younger children. A lot of times it's very difficult for them to wear a mask for long periods of time. Younger children are very social. They do a lot of hugging and laughing and playing in close proximity. So it's a little bit more difficult to protect them from each other and from COVID-19. But it was just very exciting to be able to offer the vaccine to children from the age of 12 to 17. And that's because that's a very important population, and also allows the community to open up again. A lot of people aren't able to work because they have to stay home with their kids with the distance learning. And this will allow parents to be able to return to work, for childcare to be more easily available and accessible. It won't have to be all day long, but maybe like it was before, from early in the morning for a couple of hours and for a couple of hours in the evening.
Al, I think we've had a great discussion today. We've learned a lot from these three doctors, and Dr. Hood, Robinson, Carson, we really want to thank you today for your participation. You've given us a lot of great information for this podcast, and we really want to let you know you are all three trusted voices in the Black community, and that's how come we've asked you to participate today.
And I'd like to echo the same sentiments as Herman. Thank you so much for offering your medical expertise to our community. It is vitally needed, and as Dr. Robinson indicated, The vaccination rates are lower in our community, and we have to get them up. It is so important to get our people vaccinated. So thank you all so much for your expertise.
Thank you.
Thank you, and you're very welcome.